everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Today I'm going to be sharing with you some key points or some important facts you need to take note of when writing your practical exams, starting from the ethics and also the things, all the stuffs you have to do before your exams. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Come back. Like I said, I was going to share with us the key points in practical. But before I go into details of what you are to do before each procedure and what you are to do after each procedure, I would like you to keep in mind the ethics of nursing. I would like you to do what? Keep in mind the ethics of nursing. 1. You should not put on dangling in your rings when going for your practical exams. Your hair should be properly packed, not lying or flinging up on your shoulders. Your uniform should be clean and properly ironed. Your fingernails should not be painted, they should be short. They should be short as possible, like very, very small if possible. Then also your shoes should be well polished and clean too. You have to look decent, you have to look smart when writing your practical exams. So now I'm going to give us some tips you have to take note of before and after your procedures in your practical. So the acronym I actually use that helped me to succeed during my practicals, these are the first thing I had to take note, is GPAL. G what? GPAL. I will explain. G simply stands for greet the patient. Good day, Mr. Sandra. Good day, Mrs. Sandra. Good day, Mrs. John. Good day, Mr. John. Things like that. You have to greet your patient. You don't just bump into the patient like that, all in the name of practicals. You have to greet that patient. Good day. Good afternoon, Mr. John. Good afternoon, Mr. James. How are you doing? Greet your patient. Then after greeting your patient, the second is I, informed consent. You have to explain what you are doing to this patient. Mr. Jones, I'm going to be carrying out wound dressing on you. Should I go ahead? You have to explain what you are doing, the importance of what you are doing, then seek informed consent. Then when the patient gives you the go ahead, you feel fine. You go ahead with the practicals. So greet patient, informed consent. P, privacy. The privacy of your patient should not be underestimated. You have to ensure privacy. You have to screen your patient before your procedure. Then another is A, which is assistance. There are some nursing procedures that require assistance. For example, wound dressing, bed making, bed baths. There are 2 nursing procedures. At this moment, you have to call for an assistant. Tell your supervisor you need an assistant for this particular procedure. Then the other is wash your hands. You don't begin any procedure without washing your hands. So you have to what? You have to wash your hands. So these are the 5 key points or the 5 key things you have to do before any procedure. This is what GPAL. Then the other thing you have to do after every procedure is T-word. It's what? T-word. The first after every procedure is what? Tidy the patient's bedside. You don't leave the patient bedside scattered. You have to tidy what? The patient's bedside. You have to also wash your hands. Appreciate the patient. Thank you, Mr. Jones, with a broad smile. Arrow, remove equipment from bedside. Is it your trolley? Is it your amper? Everything you took to the patient's bedside, just try as much as possible to remove it. Then D is documentation. You know, in nursing, what is not documented, it's not done. So you have to document your procedure. And also what I want you to note is that your boldness in carrying out this procedure makes your supervisor or your lecturer have that confidence in what you are doing. So whatsoever you are doing, you have to be bold. Thank you very much for staying tuned. Thank you very much for watching this video. If you got value, kindly click on the subscribe button, turn on the notification button, like the video, drop a comment, and also share with a friend. Thank you and have a wonderful day ahead.